This is Dr. Britt Skaathun. She's a postdoctoral fellow at the Infectious Diseases and Global Public Health at the School of Medicine, University of California at San Diego.
Hi, everybody. Thank you so much for allowing me to share with you some of our research that we're doing. I'm from UCSD, and this project is actually led by Dr. Joel Wertheim, and I'm presenting on his behalf. I'm one of the investigators. So this is an example of one of the CFAR supplements, and I thought it'd be nice to go through in depth sort of how these work and the different stages of them. So for this particular project, we're trying to address the respond pillar of the EHG initiative. And our main goal for this is to establish a framework for and the feasibility of using molecular networks, molecular network data to seed a social network recruitment strategy that will then help us identify people who are at risk for HIV or people who are out of care. And so this is a partnership between UCSD and the LA County Department of Public Health. So just to give you some rationale, we, as many of you know in this room, unfortunately, transgender women face a disproportionate burden of HIV infections, both here in LA County and across the US. So in the US, transgender women have the highest percentage of new HIV cases. And to give you an example of what that looks like, overall testing events, 1.9% of the testing events among transgender women ended up in a new diagnosis, compared to only 0.9% among cisgender men and 0.2% among cisgender women. And here in LA County, the estimate of HIV prevalence among transgender women is about 17%, and the burden is highest among American Indian, Alaska Native, and Black African American transgender women. So at the same time, rates of engagement and prevention services are pretty low among this group, and that's because of a lot of stigma and concerns about mistrust in the health community, also social factors, a plethora of very justifiable things that are going to make it difficult for the traditional methods that we use to get HIV prevention messages out difficult. So we need to come up with more creative approaches to getting people engaged. And so we thought we would start by just using some information that we already have. And so our plan is to use the HIV public health molecular surveillance data. So this is data that's actually been being collected in California for about 14 years now. And it includes, so the CDC funds the LA County to collect this information, and it includes demographic data, HIV transmission risk, geography, so where people are getting diagnosed, laboratory data, and also viral genotype. So the genotype is collected to determine whether or not you're resistant to different treatments. But this genotype data can also be used to put together a molecular transmission networks. And so Dr. Wertheim developed a platform called Secure HIV Trace that allows health departments to do this. So LA County puts the networks together, I think, about on a monthly basis, and other health departments across the nation are doing so as well. So you might be wondering, well, how will these molecular networks help? Well, I thought it's easiest to talk about it visually because it's a bit of an abstract concept. So if we look at the index case, the person in the middle, and let's presume that they're someone who is newly diagnosed with HIV. Well, we can see here that their virus is genetically linked to 3 other individuals who are HIV positive. 2 of the 3 are either out of care or not virally suppressed. So we would want to prioritize those 2 people who are out of care or virally suppressed more than other people who might be, because we know that these people are linked to somebody who is newly diagnosed with HIV. So if we have limited resources, we would want to start here. But at the same time, we can also talk to this person who's newly diagnosed and ask about their social connections and test them for HIV. So if they're negative, we can link them to PrEP because we know they're at risk since they're linked to a new diagnosis. And if they're unaware of their infection, we will get them linked to care and diagnosed. So how does this help the transgender population? Well, Dr. Wertheim and some colleagues decided to look at all of the molecular networks in LA County. This was a publication that came out last year in HIV Lancet. And what they found was that transgender women tend to cluster together more than other individuals. And so transgender women actually also are more likely to cluster with cisgender men who are not MSM. And in particular, a cisgender person who clusters with a transgender woman is more than 9 times as likely to cluster with another transgender woman. So in sum, we could use this information to then find additional people who are HIV infected, unaware, out of care, and at risk. So between 2011 and 2015, here in LA County, on average, there were about 23 transgender women who were diagnosed per year and 36 genetic partners that were linked to transgender women per year. So there's about 59 people that we could ask to help us in this effort in identifying people in their social networks that could then be linked to services. So let me explain what that means. So we're using what's called a social network recruitment method, and it's actually been used for quite some time in HIV prevention in a sort of a different form. Called partner services. So if you're newly diagnosed, you're asked to give the names of your partners. But it turns out a lot of people don't like to give the names of their partners, or maybe they don't know the names of their partners, and so it hasn't really been a very effective method nationally. So on average, for every person you talk to, they give less than 1 name, and then out of all the names given, only about half are HIV positive. So really low yield for a lot of effort. So at the same time, though, thankfully, we found that people are willing to give the names of their social partners, so their friends. And because of the nature of social networks, we know that social behavioral norms and activities are shared within networks. So if you have somebody who's newly diagnosed with HIV or at risk for HIV, then it's a high likelihood that someone else in their friend group is going to also be unaware of their infection or need links to services. So our plan is to take the people that we identified in the molecular network and ask them to come in and be a part of this research study where they will then recruit their friends to do our activities. So we're going to ask people to take a very brief survey. We don't want to burden them. Do HIV testing, and if they're negative, then link them to PrEP. So they'll be compensated for these activities, and then they'll also be compensated for recruiting their social network. So they'll get an incentive per person that they bring in. And so, while this project was designed to address the respond pillar, it will also be addressing the diagnose, treat, and prevent pillars as well. And then we are adding another component where we want to do some epidemic modeling. So we're going to take all the data that we get from this, run a bunch of different simulations to predict whether or not certain interventions that are used within these networks will be effective and which interventions will be the most cost effective. So this is sort of down the line, but the goal would be to identify the interventions that get us to this 90% reduction in new incident cases. So as the previous speakers mentioned, this whole process, this whole phase is a planning phase. It is a really unique opportunity to kind of hone in and get a strategy that works. And so what we've been doing over the past few months, UCSD has been meeting with the Department of Public Health on a regular basis, and we plan to continue to do that. And we're going to come up with a rough protocol that then we will bring to the Commission on HIV, the Transgender Caucus, other officials, anyone who really wants to provide feedback on this. We want to refine this protocol so that we can know that once we implement it, it will work. And then at the same time, we have to figure out which data sources that we'll need to best hone in on the epidemic model. And then when the next round of funding comes out, hopefully we will be awarded the funding and be able to actually implement the protocol. So at that point, we would want to see if it does indeed reduce the burden of HIV among transgender women. And if it does, then we can use it as a proof of concept so that we could use this same strategy for other populations. So other populations both in LA County, but also in other settings across the US, which will be a bit more difficult because geography and culture and everything is a lot different, but it's a starting point. And the more data that we get, the better the epidemic models will be as well. So those are the plans. So currently the resources for LA County, this is funding for partnerships. So we're partnering, as I mentioned, with the Department of Public Health, Commission on HIV, Transgender Caucus. Right now, actually, we would love your feedback. We're trying to find partners to actually implement the process. So do the testing, do the survey, linkage to PrEP. And so we'll have funding to find partners. Right now we're speaking with the PrEP Centers of Excellence, but if there's anyone else that you would suggest, we'd love to hear about it. And I also just wanted to take a moment to thank Mario and Cheryl for their support for this project. And thanks for your attention.